This is episode 25, Talk Therapy, Meaning and Understanding, with Kari Pearman. Today, Lisa's talking with Kari, defining what is therapy, talking about hypnosis, neurofeedback, reparenting, EFT, which is Emotional Freedom Technique. Also going to be mentioning Gangaji, Berne Brown, Dr. David Hawkins, all on the Alternative Health Tools podcast. Before we get into the show, I wanted to mention that we renamed Health and Wellness Encinitas podcast to Alternative Health Tools. Over the last year, we evaluated exactly what this show is about and how it can help people, and renamed it Alternative Health Tools Podcast. This is for those looking for insights and tools of proven alternative health. We also put up a Facebook page, which can be found on Facebook by searching for Alternative Health Tools. From there, you can listen to any of the episodes we've already published. Now for the show.
Welcome back. This is Lisa Thorpe with Intel Bio and Thorpe Institute of Integrated Medicine. Today, I have Kari Pearman, our marriage and family therapist, with us, and I will divulge right now, this is not just another health and wellness practitioner. This is one of my very best friends who I love dearly. Kari, thank you so much for coming in today.
You are so welcome.
Yay.
I know we've talked about it for a long time.
Yeah.
And
you had
I'm
to make
finally
sure.
here.
You had to make sure what was really going on.
Right.
And our schedules finally collided.
Right.
So I want you to just tell people a little bit about what you do.
I'm a marriage family therapist and have been I was trying to think back of how long I started, and it seems like a couple of years ago it was 10 years, and now I'm getting somewhere into like 18 years.
We're dating ourselves. It's been
therapist.
a lot more than 10, yeah.
Yeah. And so I, have a really diverse clientele that I've seen for a long time of all ages, with couples and families and individuals, and I'm also a neurofeedback practitioner and also trained in hypnosis and EFT, Emotional Freedom Technique, used for trauma. So I have a little bit to my repertoire.
It's quite a full toolbox. So you see people on a regular basis. You do regular therapy, and
I do.
And you once said to me something that was really impactful about therapy, because I think, for me, like many people, I kind of grew up with this idea that you only go to a therapist if you're like screwed up. And you're like, well, it really used to be the luxury of the rich.
Yeah.
And I was like, wow, that puts a whole new perspective on the fact that if this used to be something that was a luxury that wealthy people could afford, because it actually is a really huge benefit to be able to go to somebody else and talk about what's going on in your life. And I think made me start to think of therapy in a different way.
Yeah, I mean, there was this idea that most people were getting their basic needs met. And so...
Who's that?
This is Maslow's hierarchies of needs. That was, most people are just trying to get, food and shelter. And so it was actually just a certain small portion of the population that, had the luxury of kind of, figuring out emotional growth and spiritual growth. But now with social services and, court systems, it's really funneled people into therapy. But the truth is that most people still don't understand what therapy is. And most people come into my office very confused about what it is and what it isn't, and the vulnerability of being there, and, what family thinks of it or their husband thinks of it. And so I don't think that it's talked about. I still think there's a lot of stigma and shame and confusion about therapy.
So what is therapy?
Essentially, it's a place to be able to really kind of talk about what's going on with you and sort of have someone who guides you. Most of the time when people come in, they'll say, oh, are you going to tell me what to do? And I always say, I'm sure you have plenty of family and friends that have done that for you.
Right.
And what therapists do is we sort of are trained in asking you the questions to give you space to explore. You know, why do I think this way? Why do I feel the way I feel? What is it? Where did it come from? You know, so it's kind of a creative process. Some people come in and they want structure and they want homework and they want books. And that's fine too. But I'm kind of a therapist that sort of just kind of works with the person individually and figures out, you know, do they need more direction? Do they need more space? Do they just need to be heard? You know, what is it? And so that's kind of the creative process of the therapy that I do. And it's passion. It's very passionate to me. And I've learned a lot through the process over the years about myself and people. I don't know if I'm getting off track, but back to therapy. I mean, therapy is really just having somebody that can help you kind of guide you through whatever you're going through. And it is a parenting process. And
a reparenting process.
A reparenting
right?
process.
Because we know no parents get it right the first time. So it's kind of like if you go into therapy, you get a chance to reparent yourself with somebody who's unconditionally loving.
Right.
Right?
Yeah.
Yeah.
Absolutely.
And you are that. And I'm
well,
here.
Thank you.
I'm a testament. Kari's unconditionally loving. You're a great therapist.
Thank you.
Even as a friend. So you talked about the books, and this is something I was looking forward to talking about while you're here, is because we share some favorite books.
That we do.
We do.
Lots of them, actually.
Lots of favorite books
Yeah.
that are books that people can pick up and that they can use to change their own lives.
Right.
And some of them are not even books, actually even videos. Like we've both really enjoyed some speaking engagements and videos by Gangaji.
Right.
And I know that's one, so maybe you can touch a little bit about how you use that sort of tool in your practice.
Gangaji, I love her, and there's many people that love her too. She has a huge following. She has an esoteric feel about her, meaning that most people like more practical people. So like Berne Brown has books on shame, and a lot of people gravitate to that. It's very practical. It's simple to read. You know,
I leafed through that one really quick. But the core message, and this is what I love about sharing this kind of information, is you gave me the Cliff Notes. I leafed through it, and I got the main point from that, which was we need to have compassion for our own shame.
Absolutely.
And what a powerful thing that is.
And even more than compassion, how important shame is in actually being part of emotional and spiritual growth and deeper connections with other people. So I love that Berne Brown brought in the big piece on shame.
You mean we can't just learn to be narcissists and forget about our shame?
Right. Yeah. Denial. I mean, we're very conditioned to not feel, to push things away, to sit in apathy and just go into shutdown. We really are not taught to make space for how we feel. And so as a therapist, when people come in and they're grieving, there's always shame about it. You know, I'm embarrassed that I feel this way. I feel like I should be done right now. I feel like I should be back to work. I feel guilty that I'm isolating. And nobody says, you're in grief. And in grief, there's a healing time. Can you make space for it? Is there any can the world stop for a little bit? And we live in a society that says, no, it can't, And
it reminds me of something I've told clients in our work, which is if you don't take time to heal, the healing is going to take more time. And I see it regularly with people with injuries because I'll be like, look, get off, lay down, immobilize as much as possible at the very beginning and you'll heal faster. Or you're gonna keep re-injuring and it's gonna take a long time. And I think when it's literally a broken bone, it's a little bit easier to comprehend. But when it's the loss of a loved one, you don't see that wound. There's no crutches to let go of or take away.
Right.
But yet it's the same premise.
I love that you draw that parallel because it is true. If you break your leg, people say, you
need time off.
And even when I've broken my leg, to actually stop has been hard. You feel this like, oh, but I want to get up and go swimming tomorrow, and I'm supposed to just sit here for how many months to do this? But with emotional stuff, we don't think about it the same way. We don't think that there's a healing time, that essentially it's similar to a broken leg, where the life that we had, it's not going to be the same. There's going to be, and people try to push through it. And I've seen this as a therapist. My mom died, and I'm working more hours. I'm pushing through it. And eventually your body will shut down. Is what happens.
The emotional unrest becomes a physical issue, right?
It does. People will either end up with panic attacks where they literally can't go to work. They'll end up with sleep disorders where they can't go to work. I mean, everything in your body will say, I don't care what you think you have to do. Until you handle this, until you go through the grief and experience it, we're not moving.
Right. Well, and there's so much now on how our emotional well-being, if it is not taken care of, it becomes physical disease. So not just shut down, can't get to work, but you're going to wind up with cancer. And I don't want to say wind up with, but it very may well lead to an actual physical disease if not dealt with in the emotional phase.
Right. Yeah. I mean, they know, this correlation between, mental health and, physical health. And that's another reason to go see your therapist.
Right. There you go, people. Get in to see Kari. Get in to see. So who nowadays, who needs therapy?
I think everybody could use therapy, but obviously, I think people in transition are good candidates for therapy. People who are obviously going through divorces, who their kids are leaving the house is a big one. They call it the empty nest. Kids before they go to college are a good one. The teen pressure to get to college and then to just be in a different state all of a sudden,
right?
Living a whole different life.
We don't think about. We kind of take for granted that teens should be able to just handle that stuff.
Oh yeah, the teens are really, really stressed. I mean, nobody. And they're embarrassed if they go to junior colleges and that kind of thing too. So, and a lot of them have been working so hard to get to these colleges, and they never pre-think, well, what is it going to be like when I'm, out in Arizona, or when I'm in Denver, Colorado, and I've spent my whole life in, Escondido or whatever. Right. Yeah.
Big transition.
Mm-hmm. So transitions are a good one. A lot of people go for self-growth. There's things that they didn't really talk about ever that were part of their past growing up. Maybe their parents divorced when they were little, or some kind of abuse that they had, or some kind of a trauma, and they're sort of going back at different points in their life to kind of say, I never really processed that. I never looked at it. And I'm wondering if those kinds of things now are keeping me from being what I could be at work, or being what I could be in my marriage now. So
go there.
Right. There's also that.
And you mentioned not only talk therapy, but you have other tools. You've worked with hypnosis as well as EFT. Maybe a little bit explain, how can hypnosis help people?
Hypnosis is really, basically it's a relaxation exercise. And so a lot of times when we're relaxed, we're more likely to listen to messages. And sometimes when we're anxious about things, we we all know this, that our fears kind of keep us from being able to open to something.
Right.
And so hypnosis is really the idea that somebody walks you through a relaxation exercise. And then you sort of go back. For example, I have a client who came in because he's a brilliant guy, and he's an engineer, and he's got to do public speaking now for his job, and it's just very stressful for him. And so we did some hypnosis, kind of just walking through going into a conference room and, kind of connecting with the people there and connecting with the space, and just doing a sort of a walkthrough about feeling really confident and relaxed while he's giving the talk. So it's a visualization and also a feeling.
Right. And there's all that research that visualization is as effective as actually doing whatever it is you're trying to get great at.
Yeah. I had another guy who got in an accident on his bicycle. He was an avid biker, and there was a construction site, and there was a wire that they had running across, and so he didn't even see it, and he just wiped out. And so we just did some hypnosis about kind of going back through his course and being really relaxed and getting up to where there's a construction site and calmly and with confidence like he had before, passing it at a very good cruising for even speed.
That sounds good for even like PTSD, post-traumatic situations.
Right, yeah.
I like the way you describe hypnosis because I think there's a connotation that it could be in some way a practitioner trying to subliminally
everybody
manipulate.
Knows the Vegas shows,
yeah, right?
I've seen them myself,
too. I'm not doing a Vegas show.
Right. Yeah. I'm not going to stand up on the table and act like a monkey. I'm sorry.
Not today, anyway.
Maybe tomorrow.
Yeah, that's good. So how about EFT, Emotional Freedom Technique?
And EFT is also actually a relaxation effort, kind of a technique where you go through whatever trauma that you have and you do a series of tapping. And these are tapping meridian points.
Right. I'm all into the energy points. These are
right,
these are real, people. These are real. It's all energy.
Yeah. And sort of bringing your nervous system down in alignment as you go through. This is kind of a basic of what it is, but there's also shame in EFT. That's one of the things that you usually say is, even though I have this problem, I fully and completely love and accept myself. So it's also going through whatever it is that you're frustrated about or experiencing. Maybe it's the shame that you have this fear of spiders. So it addresses that piece also. So just kind of, coming back to that.
So not the fear, not only the fear itself, but the other attachment.
Right, and how shame actually can kick in our fears a little bit more. They sort of interlock.
And what I like about EFT, and every once in a while I'll actually do it still because it's such a handy tool to have wherever, whenever, and it's a self tool. So it's unlike hypnosis, which you could do self-hypnosis, but typically somebody else is guiding you through. But EFT, it's something, once you've got it, you have it, and you can use it for anything, which is cool.
Yeah. I think people feel uncomfortable with it or they love it. And so, for the people that love it, they just, in 30 seconds, they can like run through this tapping exercise. And
I like to just kind of downsize it. Okay, I don't need to do all the points. I'll just do these main points and rub this. And you don't even have to tap. You could just like do a little massage, right?
Right. Yeah.
Yeah. That's what I like about the EFT.
Yeah. You're good at remembering to do it, even. You tell me. I'll do a little EFT.
Tap yourself.
Yeah.
The neurofeedback is the other thing that you do, which is pretty amazing.
The neurofeedback is very amazing. Matter of fact, my son is doing neurofeedback right now, not through me, because I believe that don't tutor your kids in math. Don't teach them to swim. Take them to other people. So I'm taking him to somebody else to do neurofeedback. But my son is 6.5 and has symptoms that are pretty much ADHD symptoms. Attention span, the normal attention span for someone his age is like, a minute and something seconds, and his is about half that. So it's a really great, I don't want to say alternative to medication, because people in the neurofeedback don't like that word, and vice versa. The medication industry doesn't like that, but it is really a great alternative to putting your kids on medication.
And it's really, the way I understand it is that it's Pavlovian. So it's giving the brain a feedback loop to autocorrect itself.
Right.
And so, especially for children, but this is for anybody that's doing it, and I've done it with you, you're looking at a computer screen, you're looking at something that's basically like a video game. And you're hooked up to leads, so you control what happens, whether the game speeds up or slows down, and you're able to start to focus. Your ability to focus or relax actually changes what's happening in the game, which is really cool.
Right. Yeah, it has a feedback loop. And so the great thing about neurofeedback is there's no side effects. You're not on a medication for a long period of time. With medication, you have to go on, kind of see how you do. A lot of people have bad side effects to it.
They all have bad side effects. I mean, it's easy.
Some people right away,
point,
sometimes it takes a while to figure out the medication part. With neurofeedback, you're getting actual feedback about what your brain waves are doing. So you can look and see, okay, you have a brain that's sort of overstimulated or understimulated. And through the use of a computer, you can correct those imbalances to kind of bring the brain to a balanced homeostasis.
It's an exercise.
It is an exercise. It's kind of similar to a disk defragmenter, when you would put the disk defragmenters in your computer and it would sort of get rid of all the slow stuff and get your computer kind of running right. That's essentially what neurofeedback does. And kids love it and teens love it because it's video games. And a lot of times talk therapy isn't really a good fit for kids.
Right.
Matter of fact, talk therapy isn't really a good fit for certain types of people. There is this assumption that everybody is a good fit for therapy, and that's not true either. You have to be able to kind of come in and talk and process things, and
not everybody likes to talk.
Not everybody likes to talk.
Introverts, right?
Right. Very shy people sometimes don't like it, or sometimes teenagers really don't want to talk at all. Teen boys. So it's trying to find kind of the right fit out there.
And neurofeedback, before we move on, the research, because you mentioned teens, the research is that neurofeedback after a certain amount of sessions actually improves IQ.
Yeah.
Which, for me, I heard that, and I'm
and
like,
your golf swing.
Yeah. So before you want to learn to golf, or before your teens are going to go take their SATs,
right?
My God, right?
Yeah. A lot of people, lawyers taking the bar are going to neurofeedback because it's, it calms down your nervous system, and also it gets rid of a lot of what's called theta, which is a slow brainwave that we all kind of end up having just because there's more toxins in the environment, and we're all
not getting enough sleep,
and stress and all these things. So most people have some level of theta that they can clear up. So it's a great kind of, it kind of gets your brain running right, and it also keeps you calm. So
I love these kinds of tools because I think it's very normal and natural for us to think about getting our bodies in shape, that we could go buy some dumbbells or go to the gym, get a gym membership, or buy some fresh juice. But it's not normal to think about how to get your brain in shape. And yet there are some amazing tools. There
really are. I mean, neurofeedback is kind of it's becoming more popular. At one point, it was like yoga.
Yeah.
People there was some people that knew about it and liked it, and now you really see a yoga boom, and people love it, and it helps bring your nervous system down, and it has so many great, wonderful things. So, and neurofeedback is coming up the ranks as well. As something that people are really interested and excited about. As technology gets better, the neurofeedback's getting more sophisticated too. So
I love technology.
Technology, right? Yeah.
So I want to interject and just let our listeners know that we love and appreciate your feedback. You're always welcome to email us at feedback@thorpeinstitute.com. If you have any questions, again, feedback@thorpeinstitute.com. There's another book that you and I share in common that's literally one of my favorite books. My Dr. David Hawkins, Power versus Force. And I have to bring it up because it's one of my favorites. And this guy was such a cool guy. He was a doctor, I believe PhD even, and he had a couple near-death experiences. He, at one point, people were having healing experiences before even entering into his clinical exam room. And he talks a lot about consciousness, and at one point even calibrated the levels of consciousness, which got condensed into a 2-sided chart, which I love because I'm all about really simple, easy tools. And so I make copies of that chart, and I know that you've made a reference to it in your practice.
I definitely use that chart all the time in my practice. Teenagers love it. It's really easy and simple to understand. And I think with that chart, I think differently about emotions and where people are. Maybe just to kind of have a little understanding about power versus force graph. David Hawkins put together emotions based on energetically where they are. So he kind of at the bottom has guilt and shame, and then grief and apathy. In the neurofeedback world, we would call these things theta. So this is kind of like a slow moving brain, a slow energy. If your brain is a light bulb, you're kind of on dim in this area. And then the next part of the graph is the faster brain waves. In the brain world, we call them beta. And these are like, anxiety and anger coming up the graph. Yeah. And then he gets to the top of the graph, and there's some kind of neutral areas. Am I explaining this right? There's neutrality and willingness. And these are acceptance rates really high, forgiveness, and then understanding. That's why they know actually that therapy works, because if you can kind of come in and talk about your problems and find meaning and understanding, it changes brain chemistry. Right. So that's on there. But just like the scientific community, at some point, you can't intellectually understand life, and you sort of have to let go and be in peace, love, and joy. And this is why the farmer can be happy, right? And according to David Hawkins, enlightenment has only been Jesus, Krishna, and Buddha at the very top at 1,000. So he has a graph. The graph it's kind of two-sided. One is sort of our ego and, trying to get our needs met and all the emotions of survival. And then the other half of the graph is what we could say spirit or love or connection.
It's our negative consciousness or our survival consciousness. And on the top is our positive, or like on Maslow's, our fulfillment when we're actually going into self-actualization.
I like to kind of think of it as like the bottom is like your primary animal. And then the top is actually like spirit. And how many times we're actually too much in our primary animal, and we're sort of unbalanced. We're not in spirit. We're thinking about our bills and our bank accounts and our problem. And
it's hard. Well, it's hard to get past survival. It's hard to get past fight, flight, or freeze. And you have to have all your needs, roof, clothes, food, fully met on an ongoing basis to start to get to those higher levels of rational thinking and understanding, and then wanting to pursue love and fulfillment. I mean, those are pretty lofty goals.
We think we do. Yeah. We think we have to have it all together to get to those lofty, but really,
it's accessible at any moment.
It's accessible at any moment.
Yeah. It's true. And
so the graph does another. I mean, it's a great graph to look at where you are emotionally. Power versus force graph, and you can go online and look at the map of consciousness at any time.
I love it. And the only thing is that it's a little linear. It's very linear. But
it's not actually a game of chutes and ladders up the graph. It's more like we dip in and out of positive and negative emotions, and at any time.
And I think the best part, which I think you're alluding to, is that it shows how normal and across the board encompassing all of these emotions are, that it's something that everybody experiences. It's part of human consciousness.
Right, absolutely. We need the polarity play. So, I mean, people will come in and they'll say, if you could just get rid of all my negative emotions, like give me the 5 tools to doing that, if you would, please. But the truth is that no matter how, rich or smart or lovely we are, we can't. That as human beings, we dive in to negative emotions and to positive emotions every day throughout our life. And so there needs to be more space and more openness also for some of the, for anxiety and depression. We have a horrible viewpoint of it. If you have depression, hurry up and go get that. There's something wrong with you. But the truth is they're very important. So I think that's also a misconception when people come into therapy.
How does the therapist get therapy?
They see you, Lisa.
Friendship.
Yeah.
That's true.
Yeah, definitely. Yeah, friendship. And, I've used tools over the years. I go to yoga and I definitely have my friends and I've had to work at it. When I first was an intern and started as a therapist, you when you go to school, you learn all these techniques and theories about how to work with people but I didn't really have life. I mean, I didn't know how to deal with all these problems in the room, to be honest. I didn't know how to deal with so much trauma coming through the door. I just didn't know how to take it on at the end of the day. I don't think any therapist does. So, I mean, it's kind of over the years, it's been a work in progress. And it's definitely a spiritual path, I think, at the end of the day, if you decide you want to go into being a therapist.
What made you decide to be a therapist?
Well, I think I've always sort of helped people. I didn't have a direct route to being a therapist. I was a sociology major in college. I minored in psychology kind of on accident. Like my last semester, they said, you're so close to a minor in psychology, you just have one more class. And I thought, well, what does a minor do? And they were like, oh, you can put on your resume, some hocus pocus. And I thought, oh, I guess so, And then when I graduated from college, I kind of cruised around with my girlfriend and we didn't know what we were supposed to do. She was going to go to National University and do a teaching credential. And I thought, oh, that's good. I'll do that. How do you do that? And when I got there, I realized, well, this minor sort of led the way for me to get my master's in it. So it kind of followed suit through there.
And you have a love and a passion for Bali.
Yeah. Yes, I do.
And I feel like a lot of your expertise in listening is similar to the way you talk about the culture there.
Huh, that's interesting.
Because whenever you make reference to the people in Bali and the way they live their life and the way that you experience them, I feel like that's the way I experience you.
Oh, well, thank you.
Yeah, you're welcome. Well, it's the reference to people being in the moment and being always with a big smile and an open heart.
Right, and a sense of humor, too. The Balinese have a great sense of humor. So...
like you. So I always ask everybody that comes to talk with me, if they were to recommend one thing for people, what would be the one thing for the number one health tip or wellness tip? What would you recommend for people?
I think I was talking a little bit about it earlier, but, as a therapist, I would say that there needs to be more space for feeling. And so, to really kind of pay attention to, is there sadness today? Are you, is your anxiety here? Is fear kind of coming? And to open to that. And, we have these old programs that shames us for feeling bad. Kind of like we have this big club that we sort of smash ourselves over the head with, all the time. And it needs to be recognized. I read in a book, it was actually Gangaji, that said, you have the absolute right to be on this planet free of guilt and shame. And I thought, wow, nobody concept. Told me. Nobody tells us. But yeah, just, to really, to kind of embrace all these feelings.
Because when we meet them, and that's one of the things Hawkins talks about, that whatever pain, whether it's shame or fear or anger or whatever is coming up, if we meet it, it will resolve.
If we open to it. Yeah. I mean, we all know the times when we're crying and then we start laughing.
Yeah.
And it's because actually when you go into an emotion, you sort of kind of balloon up to higher emotions. I don't know if we call them higher, but naturally. That we don't have to push. We don't have to fight our emotions all the time. We don't have to make them go away, or people don't have to talk us out of them. And we all know what it's like to have someone try to talk you out of your pain.
Yeah.
I mean, then you grab it tighter.
And it's because they're uncomfortable with your pain. So they're trying to talk you out of it. They're
Right.
like, it's making me uncomfortable that you're in pain and that you're suffering, and so let me talk you out of it.
It's very true. We don't have any conditioning to deal with our pain and the pain of others. To be able to sit with other people's pain without having all of the solutions and fixing and, talking up or talking down over somebody, just to connect, to stay connected to ourselves and other people.
Without our iPhone?
Without our iPhone.
Wait.
Right.
I love you.
Love you too.
Anything else you want to share before we wrap up?
No, I don't think so.
All right. Well, we'll do this again next time. Maybe we'll talk about the sexual evolution of mankind. And,
that sounds fun.
And humor in therapy.
Right.
All right. Awesome. This is Lisa Thorpe. Thank you, Kari Pearman.
Thanks so much, Lisa.
For joining me today. This is our new name, Alternative Health Tools podcast. Today we talked about some alternative health tools for your emotional and mental well-being. Thank you so much for listening. Have a wonderful day.